Hello, everyone. My name is Mike Spigler, and I am the Vice President of Patient Support and Education at the American Kidney Fund. I want to thank you very much for joining us for this virtual chat with the American Kidney Fund's President and CEO, LaVarne Burton, and Assistant Undersecretary for Health for Clinical Services and Chief Medical Officer within the Veterans Health Administration, Dr. Erica Scavella. This chat is brought to you by the partnership between AKF and the VHA to promote the health and wellness of our veteran heroes. In 2020, AKF and the VHA entered into a formal national partnership aimed at the shared objective to increase awareness of kidney disease among U.S. veterans and to support veterans who have been diagnosed with kidney disease. Our mutual goals center on increasing awareness of the risk factors, causes, complications, and treatments of kidney disease and its associated conditions, distributing resources to veterans who have or are at risk for developing kidney disease, providing veterans, healthcare professionals, and the public with resources tailored to the unique challenges veterans face as related to their kidney health. We believe that this event will help to further our shared vision of a world without kidney disease. At AKF, we are incredibly thankful to the VHA for its partnership and to Dr. Scavella for taking the time to work with us on this initiative. Before we continue, I would like to take a moment to formally introduce our speakers for today's chat. First, Dr. Erica Scavella. She is the Assistant Undersecretary for Health for Clinical Services and Chief Medical Officer for the Veterans Health Administration, serving over 9 million enrolled veterans annually at over 1,700 sites of care in the nation's largest integrated healthcare system. She previously served as the Associate Deputy Undersecretary for Health for Oversight, Risk, and Ethics, executing the duties of the Chief Health Risk Officer. In this role, Dr. Scavella provided executive leadership for 5 aligned national program offices: the Office of Integrity and Compliance, the Office of Internal Audit, the National Center for Ethics in Healthcare, the Office of Research Oversight, and the Office of the Medical Inspector. She was also responsible for VHA enterprise risk management, healthcare-related oversight and accountability, and VHA centers of excellence. Prior to serving as the Associate Deputy Undersecretary for Health, Dr. Scavella served as the Medical Inspector, conducting over 150 clinical investigations and overseeing over 100 more. In this role, Dr. Scavella and her team implemented impactful clinical care improvements across the system. Dr. Scavella is certified by the American Board of Internal Medicine, was elected Fellow of the American College of Physicians in 2005, and Fellow of the American College of Healthcare Executives in 2012. She is a member of the Leadership VA Class of 2009 and served as the 2015 to 2017 LVA Alumni Association Membership Chair. She completed the VHA Healthcare Leadership Development Program in 2012 and the Harvard Kennedy School Senior Executive Fellows Program in 2017. Thank you so much for being here, Dr. Scavella. Also joining us is LaVarne A. Burton. LaVarne is President and Chief Executive Officer of the American Kidney Fund. She has led AKF since 2005, propelling the organization to many notable milestones to support the 37 million Americans living with kidney disease, with programs addressing early detection, disease management, innovation and clinical research, advocacy, and financial assistance. Ms. Burton previously served as Executive Secretary to the U.S. Department of Health and Human Services, where she managed policy development and regulations and was advisor to the secretary of the federal government's largest domestic agency. She also previously served as president of the Pharmaceutical Care Management Association, deputy assistant secretary for budget policy at HHS, and senior analyst to the budget committee of the U.S. House of Representatives. Ms. Burton received her bachelor's degree from Howard University and master's degree from George Washington University. She currently serves as the chair of the National Health Council's Board of Directors. Thank you so much, Dr. Scavella and LaVarne, for joining us today. I'm really looking forward to this discussion on such important issues for both of our organizations. But before we get started our discussion, I thought I'd like to just highlight some key facts about the prevalence of kidney disease and the challenge that we are both facing. First, there are 37 million Americans with chronic kidney disease. And what is even more concerning is that 9 out of 10 people with early stages of chronic kidney disease, or CKD, are completely unaware that they have it. There are many reasons from this, from CKD usually being symptom-free until its later stages, testing for early kidney disease being inconsistent, and health literacy barriers that can lead to missed opportunities when doctors are talking to their patients. Diabetes and high blood pressure are the 2 leading causes of kidney failure. And for those of you not aware, kidney failure means that a person's kidneys have stopped working to the point that they need either dialysis or a kidney transplant to survive. Diabetes causes nearly half of these cases of kidney failure, with high blood pressure accounting for more than 1 out of 4 cases. In addition, kidney disease affects Black Americans and Hispanic and Latino communities disproportionately when compared to white Americans. Compared to white Americans, Black Americans are 3 to 4 times more likely to develop kidney failure. They are 60% more likely to be diagnosed with diabetes. Black Americans are also less likely to receive a kidney transplant evaluation and have less access to the kidney transplant wait list. And while Black Americans make up 13% of the U.S. population, they represent 35% of the patients that are on dialysis. There are similar disparities in Hispanic and Latino communities, where they are 1.5 times more likely to develop kidney failure compared to their non-Hispanic white counterparts, almost twice as likely as non-Hispanic whites to be diagnosed with diabetes, and since 2000, the number of Hispanics with kidney failure has increased by more than 70%. Kidney disease also affects veterans at a higher rate than the general population, which is one reason why this partnership is so vital. The VA currently cares for over 600,000 veterans with kidney disease, and the percentage of veterans with CKD is estimated to be 34% higher than the general population. Even worse, Black veterans are nearly twice as likely as their white counterparts to develop chronic kidney disease. So let's begin today's chat and talk about what we can do to improve some of these numbers. And Dr. Scavella, I'll start with you. Can you tell us a bit more about the impact of kidney disease on veterans?
Yes, thanks for that, Mike. So as you just showed, we have over 600,000 enrolled veterans who have chronic kidney disease. And as you also pointed out, the 2 most common reasons are diabetes as an underlying factor and high blood pressure or hypertension as an underlying factor. We see approximately, out of all of our veterans, approximately 25%, over 25% have diabetes as a complicating factor leading to chronic kidney disease, and over 37% of our veterans have high blood pressure as a factor contributing to their chronic kidney disease. So we do have lots of work to do to take care of our veterans to ensure that we are treating those primary diagnoses to prevent complications such as chronic kidney disease. We also know that our veterans tend to be more diverse than the general public. So we do have a higher proportions of both African American and Latinx veterans enrolled in care through the Department of Veterans Affairs. And we know that just based on the statistics you discussed, we know that these populations are already affected with chronic kidney disease more than white Americans in comparison. And we realize that we have a mission to take care of this issue and to make sure that these complications are avoided. So our goal is to treat the diabetes and treat the hypertension, high blood pressure to prevent these complications. One other change that did take place is recently the calculation of kidney function, which is commonly known as the eGFR, that calculation has been adjusted so that it is no longer adjusted based upon race to essentially allow a higher number or a higher level of dysfunction to be present in the population of patients such as African Americans and considered normal. So that has been eliminated, and that's making it easier for us to identify patients who do have kidney dysfunction, who should be treated more aggressively in the early stages to prevent the complications in the later stages. So thank you, Mike, for allowing us to discuss this and to bring this to the forefront.
Thank you so much, Dr. Scavella. LaVarne, can you speak a little bit about the importance of the partnership between AKF and the VHA?
Yes, Mike, I'd be happy to. This partnership really is very critical to our work of trying to make sure that veterans who are at risk understand that risk. And so we're delighted that the Department of Veterans Affairs has joined with us in these efforts to increase awareness, to make sure that veterans are educated about their risk and that they know what actions they can take. To follow up on that, the American Kidney Fund has a number of resources largely available on our website, literature, and we also have programs that are of assistance to veterans. In addition, we have programs of financial assistance to make sure that people can access health care, to help them with other out-of-pocket expenses that might not otherwise be covered. But the Veterans Affairs also has very wide resources for veterans who are dealing with kidney disease. And we want to share information, as we do again on our website, about what those resources are. They include free screening through the Department of Veterans Affairs, support to help you manage early kidney disease, which is so critical, as Dr. Scavella said earlier. It also includes opportunities for veterans to get biopsies to diagnose kidney disease if that's needed, as well as treatment for their diabetes, their high blood pressure, and management of those diseases. And if they are in kidney failure, the dialysis and other treatment and care that they need in order to get the best outcomes, even when they're in kidney failure, as well as transplantation. So working together and reinforcing each other's efforts, the American Kidney Fund and the Department of Veterans Affairs can make sure that veterans, number one, know their risk for kidney disease, that they are educated about what they can do about it, and that they are motivated and given the resources that they can take action to protect their kidneys and to have the best possible outcomes.
Thank you so much, LaVarne. It's really great to be able to provide those resources from the VHA to our constituents as well, and also be able to provide ours back as well. So Dr. Scavella, the VHA has really made a substantial commitment to addressing health disparities. I mean, you talked a little bit about some of the things that are happening in the broader community with the EGFR calculation, but can you talk about some of the work that the administration is doing to address health disparities?
Yeah, thank you for that question, Mike. So we have an Office of Health Equity here in the Department of Veterans Affairs that looks specifically at equitable concerns. We want to make sure that we are taking care of all of our patients to the same degree, and ensuring that all veterans have the most optimal outcomes. So the Office of Health Equity not only looks at populations of patients to ensure that the outcomes are consistent across racial and ethnic differences, but also ensures that we look at any disparities, if there are any, and address them, get to the root cause of what is happening, what is causing us to have disparate outcomes, and addressing those more aggressively. So one of the things that they do is they partner with external agencies across the federal government to ensure that we have the input from those other agencies to make sure that we are essentially using everything in our arsenal to make sure that veterans are getting the best possible care that they can get. There is a health equity coalition in existence, which is creating an aligned approach for us to be able to tackle these types of issues across the government. There's also a Veterans Geography of Opportunity tool, which we are using to explore different factors that influence outcomes that make it more challenging, or the outcomes that make it equitable, but we are looking at the root causes that make it more challenging for our veterans to have the same outcomes as other populations. We are partnered with AHRQ, the Agency for Healthcare Research and Quality, the CDC Office of Minority Health and Health Equity, as well as the U.S. Department of Health and Human Services, HHS, Ms. Burton's stomping grounds, through their Office of Minority Health. So we are basically making sure that we are working with all of our partners within the federal government to ensure that we have what we need to make sure that we're providing the most equitable service to veterans. We have approximately 7% of our population annually diagnosed with chronic kidney disease, and that includes all veterans. And we do know that both our African-American and Asian and Pacific Islander veterans do see increased rates of chronic kidney disease, and we want to make sure that we are looking at these populations as well as other populations to ensure that there are not any other similar areas to target. So we are doing everything possible to make sure we have the evidence to make better outcomes for our veterans.
Well, thank you, Dr. Scavella. You know, it sounds like it's a big response to a big problem, and it's so encouraging to see such a coordinated response coming from the administration. LaVarne, over its 50-year history, AKF has worked to decrease kidney health disparities. Can you speak a little bit about some of the factors that continue to influence health disparities in communities of color?
Right. Mike, you're absolutely right. In dealing with kidney disease, you have to deal with the issue of disparities in health equity if we're really going to do our mission of fighting this disease. Because as the statistics that you cited earlier on in the program say, this disease disproportionately affects people of color. And so we've got to make sure that we get to them. The American Kidney Fund has sought to do that for over 50 years of our existence. We know that people of color, that African Americans, for example, are 3 to 4 times more likely to have kidney failure. We know that there are social drivers or determinants of health that also play into the likelihood of a person having kidney disease or kidney failure. Everything from culture and language to the communities where people live to the inequities in the healthcare system. So we work very hard in terms of especially policy at the federal and the state level to turn those things around so that people have the resources that they need to fight this disease. We also know that we have to work with healthcare professionals, particularly primary care physicians, so that that kidney disease is very much a top-of-mind issue as they work with patients, especially those who may have high blood pressure or who may have diabetes or a family history of those diseases, so that they are very much alerted to the fact that a patient with that kind of background needs to vigorously watch for kidney disease and its progression and to aggressively fight that so that they don't end up in kidney failure. At the American Kidney Fund, we have defined 4 areas where we really want to focus over the next several years to try to close the gap and to address some of these disparities. One of those has to do with early diagnosis and awareness. And that's where this partnership really comes in so importantly, because it allows us to have a voice into where veterans go for healthcare, to share that information, to share information about the American Kidney Fund's activities, and also to share information about the Veterans Affairs. The next area that we're focusing on has to do with clinical trials. We need to make sure that the therapies that are being developed for treatment of kidney disease include people who are more likely to get this disease. So that's another area that we're working on. And finally, we need to address issues of inequity around access to all therapies. Whether a person needs dialysis, they need to understand their options and their opportunities to get in-center dialysis or to get home dialysis. They also need to understand how to get on a transplant list and what to best do to make themselves move up that line on the transplant list. So these are the 4 areas that we're focusing on in particular: awareness and education, inclusion in clinical trials, and access to home therapy for dialysis, as well as transplantation.
Thank you so much, LaVarne. And AKF has really made such an impact already in regards to helping with those disparities in transplant through some of our programs, and it's great to see that work really scale up and continue. Dr. Scavella, diabetes is the #1 cause of kidney failure in the United States. We talked about that earlier. What are some of the messages that VHA is conveying to veterans specific to diabetes prevention and care?
So that's a great question, Mike. I love the fact that you pose this as diabetes prevention and care. So the first thing we always want to do is try to prevent the diagnosis in the first place. So whether you are have no signs of diabetes, but you may have a family history, whether or not you personally have been told that you are at risk or have what we call prediabetes, or whether you have been told you have diabetes, we want you to do 3 things. The first thing we want you to do is to take a look at what you are eating to make sure that you are eating a balanced diet that is inclusive of lots of fruits and vegetables. And we want to make sure that you are doing what you can as far as that is concerned. Your diet is very important. So our Office of Food and Nutrition Services across the Department of Veterans Affairs assists veterans with managing all of the spectrums from no diagnosis of diabetes all the way through to a diagnosis of diabetes. We ask you to partner with them. They will assist you with making those better dietary choices. Number 2, we want you to exercise. Exercise, even if it's walking every single day or many days, I would say the majority days of each week, can make a huge difference in using the food that you are putting into your body, allowing your body to digest that food and to move it along. We know that exercise is important with so many different diseases and prevention and also management. So number 2 would be exercise. And then number 3 is if you do need to take medication to manage your diabetes or any of your other medical problems, we advise you to make sure that you're following your provider's recommendations and instructions, whether you're taking pills to manage your diabetes or prediabetes, or whether you're taking insulin. Just please follow the instructions, talk to your clinicians, talk to your providers, make sure that you are partnering with them so that we can get you on the best possible regimen. And in many cases, if you are doing number 1, watching your diet and eating good nutritious meals, and 2, if you're exercising, the medications that you're taking may be changed or reduced as you become healthier. So those are the 3 things we ask all veterans to do to be a partner in improving their own health.
Thank you so much. Well, diet and exercise seems like it's the magic bullet for so many things, but nothing more important than in diabetes. That's such good advice. LaVarne, can you speak about how AKF is working to educate the public about the kidney and diabetes connection?
Yes. Thanks again, Mike. And thanks so much, Dr. Scavella. I can only add to what you've said because I certainly very much agree with everything that you described. And one of the resources that we have, particularly help people with diet, is our Kidney Kitchen, which is online. It does everything from giving you recipes to basic food facts to shopping guidance so that you can, again, be armed with the resources you need to fight this disease. I would add that the other thing that we talk about a lot at the American Kidney Fund is that if people have a family history of diabetes, they need to be very careful in watching that because that increases your likelihood that you will have diabetes, that you will move into kidney disease and kidney failure. We want to do everything that we can up front before a person has a diagnosis, either of diabetes or of kidney disease, everything that we can do to fight it, the proper diet, the exercise, and the medications that you need to have. Early on when I came to the American Kidney Fund, I was talking with one of our patient advocates who said, I have been a diabetic for years, and I never knew that there was a connection between diabetes and kidney disease. I did everything that my doctor told me to do to manage my diabetes, but I did not know that there were additional things that I needed to do, that there were some foods that might be on a healthy diet, but because I have chronic kidney disease or a susceptibility to kidney disease, that I should be very careful about those. So we want to make sure that people who are diabetic understand those connections connections, and that they are fighting not only the diabetes, but that they are fighting the possibility of kidney disease as well. And so our website has lots of resources. We also have webinars dealing with these issues, and we encourage particularly veterans in this instance to use those resources to arm themselves with the tools that they need to fight this disease, both diabetes and kidney disease, because, you know, very often it's a continuum, and we want to stop that continuum so that people can live healthier lives.
Thank you very much, LaVarne. And, you know, there's been some new advances, lots of new innovation in the kidney disease space overall, but even in diabetes care recently too. And, you know, those things can't be possible without clinical trials that are leading to that. I'm wondering, LaVarne, if you could talk a little bit about what AKF has been doing to focus on the avenues and strategies to inform the public about the importance of diversity in clinical trials, and maybe speak a little bit about AKF's perspective on this very important topic.
This is a really important area for us and for patients. We talked about the populations that are disproportionately affected by kidney disease. Well, the sad thing is that when you look at the therapies being developed, look at clinical trials for those therapies, you find very few people of color represented in the populations that are undergoing those clinical trials. The American Kidney Fund has set out as our goal to work with companies and to work with our advocacy network to close those gaps. We've got to make sure that the therapies that are being developed for the people who need them the most. And so we have on our website, we have a section with information about clinical trials, because again, the beginning step is to make sure that you're aware of the importance, and the importance is, if I'm highly likely to be impacted by this disease, then I want to do my part to make sure that as therapies are developed, they're developed for people like me so that I can use them and so that they can help me. And then so our site deals with this issue of awareness and education. We want to dispel some myths, but we also want to be clear on the facts. There are some histories here with regard to people of color, and we want to be open, putting those on the table and talking about them so that we can deal with them. But we also want people to know, what is a clinical trial to start with? What kinds of conversations can they have with their doctors and healthcare professionals to help them understand whether they should participate in a specific clinical trial. And then we want to provide information on clinical trials that are ongoing so that people can follow up on those. But the key here is to provide information, to provide awareness so that people understand the questions that they need to ask, and so that they can make informed decisions about what's best for them. We also are working with biopharma companies in terms of talking with them about why is it that people of color in particular are not participating in the clinical trials. So we share information with them about the ways in which some of these trials can be varied to make it easier. One good example that is talked about a lot is the whole issue of, very often, people who participate in clinical trials have large lengths of time from their day that are taken up just to participate in that trial. Many of the people that we serve, because they are so their lives are so controlled by dealing with the disease, may not have that time, or taking that time to deal with that clinical trial may mean that they're taking time off from work, and work where they may be paid on an hourly basis. So there are some logistical kinds of things that you can do in addition to everything else that you want to do to facilitate that all people can participate in these clinical trials. So we're really working both ways, working with patients to inform, educate, and provide information on what's available, and working with biopharma companies as well to talk about why is it and what are some of the modifications that can be made to better encourage people and facilitate all people to be able to participate in these trials.
Thank you so much, LaVarne. Such important work being done across multiple different facets of this problem. Dr. Scavella, before we start to wrap up, I want to make sure you are doing such great work at the VHA across so many of these areas, and I want to see if there are any resources that you'd like to share with the audience.
Yes, so thank you for that question, Mike. We have a plethora of information. And what I love about this organization is that they are easy to find on the web. We have the easiest to remember web address. It's va.gov. And you can search for any and everything that you need. So on that site that I just mentioned, you can find information on kidney disease and diabetes. If you're looking for information about the diagnoses themselves, you can look for resources in partnership with the American Kidney Fund. Find other resources in the community that will help you with dealing with this change, this diagnosis of chronic kidney disease. You can find support groups that are available. So that information is available as well. And then you can find a lot of information, not just on the diseases themselves, but how you can manage your life and yourself living with these things. I've personally had a loved family member deal with chronic kidney disease, and I think that we provide world-class care when it comes to this particular aspect. So va.gov is going to be your one-stop shop for resources and information, and then to go to Ms. Burton's statements about being involved in clinical trials. We need to have people of color willing to sign up and get involved in clinical trials. So we also have research information on research opportunities within your communities across this country. So again, you can either just type in va.gov and do and use the search button and look for research, and then basically look for resources in your community, or you can actually access research.va.gov. To get the same information. It's a little bit more streamlined, but either way you choose to access the system, you can get some tangible tools and get listings of different types of studies taking place in your area that pertain to the particular interests that you have. It's just important that we get a diversity of people participating in these trials, so that when we say that something makes a difference, it's making that something is making a difference for you and for your community. And so communities of color need to get involved with research opportunities, so that when we say that the treatment is effective, we know for a fact that the treatment is effective. Thank you.
Thank you, Dr. Scavella. And we've posted some of those resources on our kidneyactionweek.org page. So you can certainly follow Dr. Scavella's advice, or we'll link directly to from there as well. So I want to thank you both. We're going to move to some main takeaways that we want veterans and family members and caregivers to know about preventing kidney disease. LaVarne, I'll start with you.
Okay, thank you so much, Mike, and thank you as well, Dr. Scavella. The main takeaway that I would like folks to have from this talk that we've had is that kidney disease is treatable and manageable. Even if you already have some stage of kidney disease, and there are 5 stages, it does not mean that you will inevitably move to kidney failure. You have the power to do something about that. And that's so much why the American Kidney Fund is partnering with the Department of Veterans Affairs, because working together, we believe that we can inform you to increase your awareness, and we can empower you and provide the resources to help you take action to manage the disease. And equally importantly, if you have a family history of kidney disease, diabetes, or high blood pressure, there are things that you can do to prevent yourself, in many instances, from getting kidney disease. Not all, but in many. And again, the information that is provided by the American Kidney Fund, by the Department of Veterans Affairs, can help you to achieve that. So what I want people to take away is that we each have the power to do something about this disease, to fight this disease. And then I want you, all of us, to arm ourselves with the information and with the resources that we need in order to have the best possible health outcomes. That's what we're all working together to achieve.
Great points, LaVarne. Thank you so much. Dr. Scavella, I'm going to leave some final thoughts with you.
Yeah, so it's hard to add a lot to what LaVarne Burton just said. She gave such great advice there. I would say the final takeaway, in addition to what she said, is that we are here to serve you. We are here to take care of you and to give you the power to take control and take charge of your healthcare diagnoses. when it comes to chronic kidney disease, we really want you to be engaged and to know what to do to slow down progression. And if you do need care, you do need medications, if you do need nutritional support, we are here to serve you. And we are looking forward to partnering and continuing to partner with the American Kidney Fund so that we can give you the most diverse and ubiquitous amount of tools so that you are going to be able to take charge of your own self, your physical self-destiny. So please, please, please use these resources. We are here for you wherever you choose to come.
Well, what a great conversation. Dr. Scavella, LaVarne, I want to thank you both again for spending this time with us today, providing some information. There's so much to talk about when it comes to preventing kidney disease, diabetes, and veterans that we hope we can continue to offer these types of collaborations to our audience and vets and caretakers that we see. So I want to thanks to everyone that tuned in today. You can join us again tomorrow for our next session on the Kidney Action Week agenda, which will be Kidney Transplant Navigating the Wait List. That will start at 11:30 a.m. Eastern Time. So we look forward to our next exciting day of Kidney Action Week. And if you aren't already, please follow us on Facebook or send us your email through kidneyfund.org, and you'll be the first to know about other resources like this. Also, make sure you check out the agenda for the rest of Kidney Action Week. For more resources related to veterans and veterans health care, please visit the Veterans Health Administration office at www.va.gov/health. And again, a lot of those links are in the conference platform. But as a reminder, if you have hypertension or diabetes, please make sure you speak with your doctor about how your kidneys are doing. And please make sure you are monitoring your numbers and attending regular checkups with your doctor so you can live your healthiest life. Once we conclude this session, you will see a poll for a quick survey pop up. Please take a minute to fill it out and tell us how we did. Your feedback will be very useful as we plan future sessions. I want to thank everyone one final time.